OK， 好。
Okay, all the investors and my friends from the media. My name is Xie Guotong. I'm the PingAn Group Chief Healthcare Scientist. And you see that a smart healthcare is providing the technological platform to our business. We have a very simple mission. We want to leverage the best technology to support and enable our healthcare business in the market, to make it differentiated in the market. Because there are many medical terms in my presentation, so I'd like to use Mandarin to deliver my speech. Today, as time is quite limited, so I'll just cover 3 parts of the smart healthcare, including the database and the algorithm, as well as the computing power. Let's start from the data first. Healthcare is a data-intensive industry. There are many structured data inside, including the diagnosis, treatment, and the prescription, and also many unstructured data, including the clinical record and the online consultation record, as well as clinical guidelines and medical imaging. These are all being called as non-structured data. Based upon our 3 decades insurance and medical experience, we are now building the world's largest healthcare data bank. For example, in our disease database, we have around 30,000 disease names in the ICD, including the root of the cause, the symptoms, and the commodities. At the same time, it will also include the corresponding genetic mutation of that disease. All those information are included in the disease database, where in our medical product database, it contains 180,000 drug instructions, including who produced those drugs and what is indication, and what the best target population for those drugs, and what would be the precise dosage of the drug, its side effect, its adverse reaction, and its retail price in different regions of the world. And all those data are included in the medical product database. Besides 180 Western medicine, and we also have around 84,000 Chinese medicine formulas in the medical product database. In treatment database, we have both Chinese and English medical literatures, and we jointly have around 33 million medical literatures, around 50,000 for Chinese literatures and 50,000 for the overseas literatures. At the same time, we also have 150,000 prescriptions, including the medical pathways, the treatment, and all those information are included in our treatment database. And another one is the medical resources database. We have 500,000 doctor information, including those highly certified doctors in China. Which hospital are they working in? What are the specialties they have? And where are they specialized and researched in?
In addition, we have 2.2 million medical researchers information in a database, and their research interests of them, what is the latest publication, who are they working with, what are they working on. This information available in a medical resources database. And last but not least, patient information database. The patient database is based on what we talk about, what we did in the last 30 years in terms of insurance, where we collect a lot of health insurance, life insurance, and we have our customers' information, where we build over 1 billion medical records into the database in the medication, treatment, intervention, all the demographic information, and also, as we say, we are the largest internet platform where we have over 29 billion online queries. So the 29 billion allows us with a lot of data mining potentials. So this is the 5 database where we collect a wealth of data. However, simply putting information together serves you no value. So actually, on the right, you see there's a spider web of a knowledge graph where we use algorithm to dive into the 5 database to mine the data and convert it into useful information. How the information is organized? It's organized around disease. At ICD with the 30,000 disease, so the disease-related symptoms, and disease-related testing, examination, medication, procedures, and what instruments are supplied to be used in the procedures, and also the corresponding genetic targets for the disease. What are the adverse reaction with other diseases? And even you can say which doctor is more experienced in treating the disease from which hospital, and what is the lifestyle change and dietary exercises, psychological counselor that's needed for a certain disease, where we have such a huge atlas of knowledge. This atlas includes 3 million concepts, 3 million notes with 36 million relations. How do we come about with this atlas? It's just like tap water purification. The tap water is a process of filter after filters. So on this side, we have 4 layers of critical filters. The first, we have to clean up the data, because from real world data, they are really messy, noisy, dirty, you name it. So very often you see in the data with people who are aging 200 years, 300 years old. This is impossible. So you see a lot of data, some critical information are missing. For example, for hypertension diabetic patients, they are lacking the continuous blood pressure and glycemic measurements. So we have to use the data governance to clean up the data, to remediate the data. Therefore, the seemingly unusable data can be turned into useful information. Secondly, structuralization. As you know, computer is good at handling structured data. However, in medical, there's a lot of unstructured data. What I mentioned, the online Q&A, the non-structured medical records, clinical guidelines, and literatures, a lot of text, and the machine cannot really understand the text directly. So I have to use a natural language processing to turn the unstructured data and extract the key information. For example, when you talk about certain medication, you talk about certain disease, they talk about surgical procedure. After extracting this data, they can structurize this data, and they can be turned into something that's useful. The third step is standardization. I think, isn't structural data useful already? But you say humans are curious animals. We call things by different names, by our own habits. For example, in our PingAn data, when we get data from different sources, just for type 2 diabetes, everybody knows about the disease, but we have over 70 different terms to describe this disease. So if you just put them together, you can never get statistical accuracy. You don't really have the accurate number of how many T2DMs. So we have to look at disease, testing, examination, symptoms, procedures. We have to use an identifier so that they can be standardized. This identifier could help us for further analytics. The fourth step is about using algorithm. This data has been cleansed, has been extracted, standardized. Now it's time for algorithm to find and map out the relations so that we can map out such a huge atlas. Such a knowledge atlas will pave the way for the medical brain for the PingAn Smart Healthcare. It supports all the clinical application and clinical decision makings. So after data, next step, I'm going to talk about AI computation platform. Now, you have the data, but if you do not have AI algorithm or platform to run it through, you couldn't do anything with the data. But this is a massive data. It's a complicated computation. So have a SFE computation platform. SFE is to enhance the speed of AI modeling and improve the efficiency of the modeling. Just to give you 2 examples. Firstly, is about the data labeling, data tagging. You say AI, you have to have, you have to have the human intelligence before you get AI, artificial intelligence. You have to have human intelligence to tag the information before machine can be intelligent. The tagging is a time-consuming effort. But do we need all the trained data to be tagged, to be valuable? Not exactly, because a lot of information, actually, I'm going to talk about, give you an example. For example, like the renal pathology. With the renal pathology have 1 billion pixels. For a doctor to look at the whole information and tag everything, he's going to spend an hour on one scan. But specialists spending 1 hour on one radiology is so expensive. So have the active learning algorithm. By using active learning, this algorithm will be able to pick the information of these on the graph. Those graphs that produce a higher value will be retained. So we retain 52% of the training data, which will attain the same level of quality as compared with using all the data on the graph. This is a massive improvement of efficiency. Secondly, training speed. I wonder you have a good idea of the learning speed, because the model become humongous now. Traditional AI model have limited parameters, but now in the natural language processing, the PORT model, they have 300 million parameters. It sounds daunting, but the OpenAI released GP3 model, they have 170 billion parameters. So to train such a humongous model, it takes a lot of time and efforts. In the past, they're going to train it by hours or by days, but now they're going to train by weeks or also in months. So FE platform is actually providing a distributed training optimized algorithm which schedule thousands of GPU server to process a complicated task to speed up the training. Just last week, we have just in the largest machine translation competition, we got the champion, first prize in medical translation, WMT 2020, which is the largest machine translation competition. Microsoft, Baidu, Tencent, Huawei, they're all in. We are in the competition. We got first prize in medical bioscience, Chinese to English, English to Chinese. So we got the first prize. There are two tricks of winning. First is based on we have massive medical database where we have a lot of Chinese and English literature. And this literature was part of the training so that we are more competent in medical translation. Second, it was our SFE. SFE actually accelerate the speed of training by 4 times. Given a limited time, we can actually train over 200 iterations of training. So the training model can continue to be more accurate so that we came out on top. So this is the last slide, algorithm. Now you have the data and the GPU hardware, and it doesn't do any good. You have to have a medical algorithm to run these numbers, to use the use cases, to solve real problems faced day in and day out in the clinics. Now, let me just give you another example, or 3 examples quickly. Firstly, was about disease prediction. Jeff has talked about it. What does it mean? It's about fortune telling. Fortune telling with a science. It's really telling you death or life questions. So we talk about sepsis in ICU, the risk of mortality from sepsis in ICU. Now, in ICU, sepsis was #1 killer. There are 6 million people die of sepsis in ICU. In this COVID, 40% of ICU patients suffer from sepsis. So our algorithm can give you 6 hours lead time to tell the likelihood of sepsis in this patient. Our results, compared with the best method nowadays, we are 23% better. That's because ICU doctor, they are looking at the patients who are plugging in all the tubes and instruments. There are various data in different sequences like the oxygens and also pulse and everything. So we capture over 300 time-related time points to give us precision to predict the sepsis in the ICU. The second case, we talk about kidney pathology in the radiology diagnosis. In China, we have over 100 million chronic kidney disease patients. To provide diagnosis, they have looked at a graph. Every pixel is a cell, so the doctor have to make a count of the cell. So we have 1 billion pixels. There are billions of glomerular cells with the small epithelial cells and all the other cells. And the endothelial cells, they have to make a count of all the cells. So usually, they will spend 30 minutes to look through these slides to give a diagnosis. But the algorithm can do it in 30 seconds and to count all the cells, identify the cells, and with the accuracy of 92%. We look at the National Life Center with 4 specialists. It's not a competition. The average accuracy was 82%. We are 70 times faster, and we are more accurate. We're not to take the job away from radiologists or the doctors, but we are taking the time-consuming and low added value portion out of the burden from doctors. This is really about human-machine integration. Algorithm can help to take some of the components where the doctor can save time for more value-added services. The last case is individualized treatment. This example was the diabetic nephropathy. This is the most important complication. About 40% of diabetic patients develop nephropathy. The next stage was renal failure leading to dialysis or transplantation. Now, for the treatment of nephrology, every patient will have different solution and they respond differently. So the key method is just like playing chess. The doctor is like playing chess. They choose a medicine to see how it works. Maybe they want to switch to another. So we have a reinforced learning. Used to be deployed in the gaming and chess application. So looking which pathway better control the disease, better control the glycemic levels, reduce complication in a relatively shorter time. So every patient have an individualized pathway that suit him or her best. This will improve the better effects, which reduce the renal failure by 25%. So to recap, firstly, smart healthcare has huge markets with various business models, and PingAn is trying many of them out. And this is not a concept. What Jeff present and what I present, technology, application, they are all being implemented already. We are going to big cities, hospitals, and doctors. They are now already using this technology application day in and day out. Thirdly, the reason we are differentiated in the market, we can do what cannot be done in the before and what can do it better. That is because we are supported by the globally leading technology capabilities by medical database, AI, computation, and algorithm. We developed the most robust medical technology platform so that the healthcare, smart healthcare, can be underpinned and enabled. Thank you.